Okay, so welcome to the second slide. So glad you made it this far. You have many more slides to go, but that's okay. Last week for the homework, you were asked to read an excerpt from Call the Midwife by Jennifer Worth, and in this video, we are going to go over how to apply Bronfenbrenner's ecological systems theory to the excerpt you read. So the exact question was, apply Bronfenbrenner's ecological systems theory to the excerpt from Call the Midwife you read. Explain factors at two different levels of the theory that influence the baby's birth. Be sure to identify which levels of the theory you were speaking about. So I'm actually going to go through all of the levels because depending on who you were, you chose different levels. And all of the levels are present in the excerpt. So we're going to start with the microsystem. Now, the microsystem refers to the institutions and groups that most immediately affect the subject, so in this case, the baby. Some of you wrote as if Muriel was the subject. She wasn't. I didn't take off points, but yeah, in future, read carefully because it was the baby's birth that was the subject, so the baby is at the center of the ecological systems theory diagram that we're kind of making. So this can include, so in the microsystem, this can include family, school, peers. The baby doesn't really have peers in the excerpt because baby, but so on and so forth. So in this, we have Muriel, who is a fourth-time mother. We know that this is her fourth baby, and because of this, we know that she is more likely to have experience. She's going to know when something's going wrong. She's not going to panic when something new happens. She's more likely to be far calmer because she understands what's happening. And this can really help the baby. So when a mother stays calm and is well informed and knows what's happening, that really helps keep the baby calm. It keeps the fetal heart rate down. It doesn't stress the baby out as much. And so that increases the baby's chance of survival, as well as she'll know when something is going wrong, and she'll be better able to communicate what's going on to her healthcare professional, so Jenny. Okay. And then we have Muriel's mother, sister, so on and so forth. So I'll read from here. I'd soon turn off the West Ferry Road into the side streets. I can see my patient's house at once, the only house with a light on. It seems that there is a deputation of women waiting inside to greet me. The patient's mother, her grandmother, or were they two grandmothers, 2 or 3 aunts, sisters, best friends, a neighbor. Well, thank God Mrs. Jenkins isn't there this time, I think. So we have all of these people here ready and willing to help Muriel, and they do. So we get into a little bit further and we read, I can well believe it as I watch Muriel's labor. Her mother and sister are sitting with her. She clings to them in speechless, gasping agony, a breathless moan escaping her throat until it passes, then sinks back exhausted to gather her strength for the next contraction. So they're keeping Muriel calm, they're offering moral support, and by doing this, they are helping the baby stay calm, keeping him less stressed, and helping his birth. So they're directly affecting his environment. So we know that Jenny, as a trained nurse midwife, is a healthcare professional, and she is the one attending the baby's birth. So that's how we know. So she is part of his microsystem, and she is directly affecting his birth by providing her services. She's helping keep both him and his mother safe and healthy, and helping the labor go smoothly. Then we can move into the mesosystem. So mesosystems are the interconnections between different microsystems. So in this case, a good example of that is the relationship between Jenny and Muriel. So the baby's midwife and the baby's mother. 2 different parts of the microsystem, they have a relationship. And this relationship that is shown to be very positive throughout the excerpt means that there's a level of trust, and this level of trust means that both Jenny can trust that Muriel will tell her if something is happening, but also Muriel can trust Jenny that she knows what she's doing, that she will keep everyone safe, and that she will take care of everything necessary. Okay, hi. Yes, hello. Yes, hello. Are you gonna help teach? Nope, okay, bye. Oh, okay, hi. Okay, bye. I don't know what's happening. But anywho, so we're going to move on from the mesosystem into the exosystem. So the exosystem is social settings that do not directly affect the child, so the baby in this case. This can be socioeconomic status, your neighborhood, government agencies, anything that's just like the next loop out from the baby. In this case, we know that they're living in the Lower East End, so we actually see it. Past the tenements where countless thousands sleep, probably 4 or 5 to a bed in their little 2-room flats. 2 rooms for a family of 10 or 12. How do they manage it? I cycle on, intent on getting to my patient. A couple of policemen wave and call out their greetings. The human contact raises my spirits no end. Nurses and policemen always have a rapport, especially in the East End. It's interesting, I reflect, that they always go around in pairs for mutual protection. You never see a policeman alone, yet we nurses and midwives are always alone, on foot or bicycle. So the East End in London is historically very poor. There's a lot of crime. This is the exosystem that the child is being born into, this neighborhood where, for reference, anyone who's heard of Jack the Ripper was operating in the East End about 50 years before this book is set, but that's the neighborhood that they're in. It's very crime-ridden. It's very, very poor. There were few social services before the 1950s. After World War II, the East End had taken a lot of damage in the war. It was bombed out a lot. And so the government kind of decided that they should probably do something, and so services started to be improved upon there. But at this point, they're very much in transition, and it's still a very, very poor neighborhood. And we also know that the family's socioeconomic status is rather low because they are living in the East End, and they are East End families. You can tell by the accent. I didn't expect you to be able to read the accent and automatically know that they're from the East End and quite poor, but the accent that they are speaking in is Cockney, and that is a poor socioeconomic status, low socioeconomic status accent. We also hear, I can read you a bit. Let me find it. Okay. We also learn a little bit about the socioeconomic status when we hear about the boiling water. So, the cot is ready, and a good-sized washing bowl is available, and gallons of hot water are being boiled downstairs. There is no running hot water in the house, and I wonder how they used to manage when there was no water at all. It must have been an all-night job, going out to collect it and boiling it up. On what? A range in the kitchen that had to be fueled all the time with coal if they could afford it, or driftwood if they couldn't. So, remember, London is slightly inland, so it's not on the ocean. The driftwood they're talking about is collected along the banks of the Thames, which is the river. It is tidal in London, but not that tidal. So imagine living in a home where there is no hot water. There's no running hot water. You can't just go to the kitchen and turn it on and, oh, look, lovely hot water. You can't just take a shower. This is going to affect how the baby is born, because this lack of hot water and these crowded conditions that talks to the sanitation available to the child, not only immediately, so sterilization of equipment is a little bit more difficult, but then also if the baby is going to be bottle fed, how do you sterilize the bottles? If you don't sterilize the bottles, the baby is more likely to get sick. On the other hand, this lack of bottle availability means that the child is probably more likely to be breastfed if the mother is able to stay home with the baby. At this point, maternity leave isn't a given but a lot of mothers were stay-at-home mothers, so we don't exactly know what is going to happen here, but we do know that the lack of hot water and the socioeconomic status is going to affect the baby, whether through sanitation or whether or not the mother is going to be able to stay home and not work and take care of the baby, whether if she does have to go out to work, she is going to be able to give that baby going to be able to find daycare for that baby, or if the baby is simply going to be left in the care of older siblings who might be quite young themselves. It was not uncommon for children 5, 6, 7 years old to be taking care of their infant siblings. So that's the kind of thing we have to consider when we're talking about the exosystem. Okay, what else in the exosystem? Okay, and finally, for the exosystem, we have the National Health Service. So Jenny is a certified nurse midwife and her services are being paid for by the National Health Service in the United Kingdom. So after World War II, it was decided that there should be a social safety net. And amongst this, it included healthcare. So every district, the country was divided up into districts depending on population density. That depended on how big the district was. And every district was assigned a nursing contingent. So that included nurses and it included midwives. The nurses would take care of anyone who was ill. In conjunction with doctors, they would also take care of the elderly. They would go to older people's homes once a week or even every day if they need it, change bandages, make sure that they're eating, so on and so forth. And midwives would deal with all the prenatal care, birth and delivery, labor and delivery, and then also for the first few weeks after the baby was born, they would be coming in every day, and for the first few days, twice a day, to make sure that the baby and the mother were healthy. This was created by the government because they wanted a healthier population. They felt that they had won World War II, and now as they needed to somewhat pay it back to the populace, and it should be a grand new world where everything is ideal and everything is wonderful and no one has to die and poverty is alleviated and all of these things. So they built a social safety net, including the National Health Service, which still exists today in England. Healthcare is still free, mostly. You pay for it with your taxes. Instead of having health insurance, you just pay your taxes and you get health care, if that makes sense. So this is a government agency that is directly affecting the baby. Had he been born 10 years previously, he might not have had a trained midwife. And we hear about this as Jenny is talking. So she talks about all medical students in the 1950s were trained by midwives. They had classroom lectures from an obstetrician, certainly. But without clinical practice, lectures were meaningless. So in all teaching hospitals, medical students were attached to a teacher midwife and would go out with her in the district to learn the skill of practical midwifery. So these nurses are highly skilled, they're highly trained, and they are being assigned medical students to bring out with them into the district, so where they're working in the public sector, to show them how to do it. Okay, next up we have, Tansy, stop that. So next up we have the macro system. The macro system refers to cultural values, that kind of thing. So the official definition is the macro system describes the overarching culture that influences the developing child, as well as the microsystems and mesosystems embedded in those cultures. Cultural contexts can differ based on geographic location, socioeconomic status, poverty, and ethnicity. So the biggest culture thing that we see in this excerpt is the men. So I'm going to read you 3 excerpts from here about the men, starting with when Jenny first arrives at the delivery. So, lurking somewhere in the background of this powerful sisterhood is a solitary male, the origin of all of the commotion. I always feel sorry for the men in this situation. They seem so marginalized. So men are not an active part of labor and delivery like they are today. They are not brought into the room. They are not offering active moral support to the mother. They're just kind of off in the background. Yes. And then they don't even come in until after both the mother and the baby have been cleaned up. So and that's what Muriel's mother does. So all that remains is to clean up. While Mrs. Hawken is washing and changing her daughter, I examine the placenta. It seems complete and the membranes are intact. Then I examine the baby, who appears healthy and normal. I bathe and dress him in clothes that are ridiculously too big, and reflect upon Muriel's joy and happiness, her relaxed, easy countenance. Stop it, Tansy. She looks tired, I think, but no sense of stress or strain. There never is. There must be an inbuilt system of total forgetfulness in a woman, some chemical or hormone that immediately enters the memory part of the brain after delivery, so that there is absolutely no recall of the agony that has gone before. Hi, Tansy. When everything is shipshape, the proud father is permitted to enter. These days, most fathers are there with their wives throughout labor and attend the birth. But this is a recent fashion. Throughout history, as far as I know, it was unheard of. Certainly in the 1950s, everyone would have been profoundly shocked at such an idea. Childbirth was considered to be a woman's business. Even the presence of doctors, all men until the late 19th century, was resisted, and it was not until obstetrics became recognized as a medical science that men attended childbirth. So, there you have it. Men aren't... What? What do you need? Hi. She is being a pain in the ass right now, isn't she? Yes, we are trying to teach the students about Bronfenbrenner. But you must be worshipped. You must be worshipped. Yes. Okay. So, men are not actively involved in it. And more than that, they are not really involved with midwives. So you hear you hear Jenny talk about that, reflect on that a little bit. I regret that I have not been able to get to know the men of the East End, but it is quite impossible. I belong to the women's world, to the taboo subject of childbirth. The men are polite and respectful to us midwives, but completely withdrawn from any familiarity, let alone friendship. There is a total divide between what is called men's work and women's work. So, like Jane Austen, who in all her writing never recorded a conversation between two men alone, because as a woman she could not know what exclusively male conversation would be like, I cannot record much about the men of Poplar beyond superficial observation. So because Jenny is a midwife, she doesn't even know what the men talk about. She doesn't really know what they think about or who they are, other than these somewhat awkward figures in the background waiting to be allowed in to meet their new children. So that's an important aspect of, yes, an important aspect of the culture in the East End of the 1950s. And then we also finally have that midwives are safe regardless of the crime. So you heard that at the beginning of the excerpt. You never see a policeman alone, yet we nurses and midwives are always alone, on foot or bicycle. We would never be touched. So deep is the respect, even reverence, of the roughest, toughest docker for the district midwives that we can go anywhere alone, day or night, without fear. So that's a cultural thing, that even though police officers are considered the enemy, midwives are safe and they are to be protected because they are offering a very important service to maybe not the dockers themselves, but to their wives, to their daughters, to their sisters, to their mothers, to their aunts. And because of that, it is very important that they be respected and never be touched. Finally, we have the chrono system. So the chrono system is kind of the place and time where the person is. So in this case, the chrono system is London's East End in the 1950s. And more than that, the chrono system can change over time. So the East End of London of the 1950s is completely different from the East End of London today. And Jenny kind of does a really good job of breaking down how the chrono system has changed in the East End in terms of midwifery and in terms of birth practices. So she goes, I reflect on the incredible advance in midwifery practice over the century. The struggle dedicated women have had to obtain a proper training and to train others. There has been recognized training for less than 50 years. My mother and all of her siblings were delivered by an untrained woman, usually called the good wife or the handy woman. No doctor was present, I was told. So historically, women who had a lot of children successfully would become midwives themselves, and because their personal knowledge and then over time the knowledge that they gained from helping other women, they became very knowledgeable. Unfortunately, this knowledge was not formal training. They did not necessarily know how to take a fetal heartbeat. They did not know how to check for preeclampsia. So it was a very risky business because of this lack of training. However, it was considered wrong for men to be involved in childbirth. It was a cultural taboo. So over time, as childbirth became to see as more natural and as a healthcare situation, women were able to get actual training, and obstetrics became a real thing, and so on and so forth. And that's how we moved from completely untrained, mostly unassisted birthing 150 years ago to giving birth in hospitals with all of the fancy equipment and all of the medications. Today, the chrono system changes over time. I hope that was helpful and it gave you an idea of how the different systems can be found in the reading and then also how they can be applied. The rest of the lecture are videos that I found from YouTube. They are not me, and I will see you next week to answer more of your questions.